Hi, everybody. Welcome to our billing session today. For those of you who have not met us in person, I am Karen Sagor, and this is Josh Clickman, and we are part of the billing team here at Foothold Technology. Today we're going to be showing you a new feature that was implemented or deployed just a few months ago that will enable you to submit your billing to your through a clearinghouse directly from awards as opposed to downloading to your computer. The clearinghouse is Change Healthcare. So before we get started, I just want to get a sense as to who we have in the room as well as who we have listening in remotely. So I'm going to ask a couple of questions. First of all, I'm just wondering how many people here are currently using the awards billing builder? Okay, that's a fair amount. Anybody online? Not yet. Okay, we were getting some responses that they are. Okay, great. And regardless of whether you're using the billing builder or not, how many payers are you working with today? Oh, somebody want to give me a number? A lot? 35. That's higher than I thought. 35, 20. What? Yeah, insurance companies. 7, okay. So it's a range, but for some people it's getting pretty high. And how often, whether you're using awards or not, are you generating claims that you're submitting to your payers? Weekly, every other week, once a month? Yeah. Depends on the program, yeah, because some of them are monthly. Okay. So it ranges a lot, but let's kind of take that information and come up with one scenario, and that could be that a typical person who's billing, whether it's through awards, we'll take in this situation, you are generating invoices for, let's say 15 insurance companies every 2 weeks, and then you have to download the claim files from awards to your computer. If you aren't currently working with a clearinghouse outside of awards, you're then logging into 15 payer portals, and you're uploading your files there. And then you have to remember to go back to those 15 portals to look for those responses back from them, and download those to your computer, and upload those back into awards. And all of that, to me, sounds an awful lot. It's a big mouthful. It's a lot of stuff that you have to do. And what it boils down to is, the more managed care kicks in different models of the services that we're providing, the more time you're spending uploading and downloading files. And then once you're using these files and uploading and downloading them, you have to keep track of which ones were submitted and which ones did you hear back on. And it's a lot of maintenance. The new linkage that we've created with Change Clearinghouse is going to simplify this, and we're going to show you how to do that in a few minutes. Okay. So first we're going to talk about what we're going to cover today. So I'm just going to go through our, that's not the right, yes it is. Okay, it just looks different from what I have on my page. Regardless of how you're billing, whether it's through awards or not, when you're using awards, actually if you are using awards, you need to have certain data in awards in order to be able to generate invoices. And that data is located in the client chart. There are certain pieces that are included in those claim files. It's included in the billing builder configuration. And there's actually a few other places in awards where you're collecting data that can become relevant to your billing depending on what your billing model is. So I'm going to be going over some of that information with you. Josh is then going to take over, and he's going to first give just a quick overview of what exactly a clearinghouse is. Many of you might know, some of you might not. We want to make sure everybody knows. And then he's going to talk about how to transmit through awards, how to transmit those files to Change Clearinghouse, how to retrieve the responses and pull them back into awards. And then if you sign up for the Change Clearinghouse portal, you're going to get access to their database called Revenue Performance Advisor, or RPA. So Josh is going to give you a little bit of a preview about that. And then lastly, he's going to talk about the sign-up process and what the implementation process looks like for that, so that you can know what to expect if this is something that you're considering. And lastly, we have built time at the end of the session for questions, but if any questions come up during the presentation, please do let us know. We'd like to hear from you during the session as well. Okay? All right, so we can go to the next screen. So I'm going to talk about some of the data that we enter into awards, and I'd actually like to show you where that data is located. So we're going to switch to awards. Great. And when we talk about demographic data, client's name, their birthday, their gender, their address, there's more than one way to get to that information in awards. But because I'm a BillingBuilder person, there is a way that I have come to like to use a lot, and I don't know if it's very common. I didn't use it a lot before I was using the BillingBuilder every day. And that's through what we call the consumer billing dashboard. And so I'm going to have Josh look up my client, Mary Jane. Great. And she's in a program that we're calling Outpatient SA Clinic 1 in our demonstration. And if you click on her name or on the name of the program, you get to a page that gives you access to various locations in awards. And for programs that are interacting with the BillingBuilder, there's always this billing dashboard button in that row under the program. So if you click on the billing dashboard, you're taken to a new page that has a whole row of buttons across the top of the page. The buttons on the right side of the page are very much billing related, and the buttons on the left include links to the information that you have to have in the client's record in order to be able to generate invoices for them. So it's all here in one place, and it's easy to get to, easy to look up, and in most cases easy to update. So let's click into demographics data.
Karen, I just have a quick question.
Sure.
My chart, that doesn't look like that in my program.
What do you mean?
Like if you go back one, it does not look like that.
Your dashboard doesn't look like that? Really? For the programs that you're billing for? Oh, will you send help desk questions about that so I can look at it? Okay. Do you guys work at the same place? And who else? Yeah. Okay. But let me know and we can. I looked them up. Okay, send me a message. Send the help desk a message and we'll take a look at it, okay? All right. So again, we're going to go into demographics data. Demographics data is where you're going to enter the client's name, the birthday, their gender, and their address. And the thing is, when you're submitting this information to the payer, they want to see the information exactly how you have it entered or how they have it entered in their system. So you're not providing them information about what their gender is. You're meant to match what their gender is. This is how they make sure that you guys and they are on the same page about who you're billing for. So the client's name should match, the spelling and all of that should match the way it looks on their insurance card. If there's a nickname, you can put that in the alias and as opposed to in the first name page field. Same thing for birthday and same thing for address. Gender gets a little complicated because we have a few ways to document gender in awards. There's the gender identity field, the sexual orientation field, and the sex at birth field. And again, the gender you submit has to match what the insurance is.
Which one?
I'm going to get there. That's where we're getting. So the one that speaks to billing is sex at birth, okay? And that happens because when a client comes to you and you ask them what their gender is, what their identity is, they might be at a place where they're identifying as something other than what their insurance company has for them, right? If I'm going through some questions about how I want to identify myself, I'm not going to be contacting my insurance company while I'm going through that decision process or that coming to realization process. I'm going to go through that first. And then maybe, if needed, I will update them on that information. So gender identity is where you enter how they view themselves. That's what you look at when you're trying to keep person-centered treatment in mind and how you're interacting with them. Sex at birth is what you're going to use to talk to billing. Okay, so that's what matches, again, what's on their insurance card if it's listed there or whatever, you know, in insurance verification. What's up?
Question, if you have a client that doesn't have the insurance card, what is your plan B at the moment?
So if they don't have an insurance card, what's the plan B for the person entering the data? But they're insured, so you can reach out to the insurance company and get that information. There's ways to do an insurance check. What's it called? Eligibility. Thank you. You can do the eligibility, and that should give you that information back. Yeah.
Yeah, I was going to ask the same thing. Is there an automatic eligibility checking function?
In awards, there is an eligibility checking, but it is manual.
Okay.
Change Health does not give access. The link to Change Health does not give access to that yet, although that's something that we might be looking into.
They're not taking the 275?
No, Change Healthcare does real-time eligibility, which we will be interfacing with later this year or early next year. So you'll have real-time eligibility information funneling right into the awards interface from Change Healthcare
Yeah. Okay.
in the pipeline.
Yeah.
Exactly. I guess you'll get to whether that works with the calendar or not.
Okay. So for
Not today.
yeah, and the questions that were asked were, can we do eligibility, real-time eligibility text through awards that's coming through with Change Healthcare, and will it interact with the calendar or not yet? Okay. Oh, by the way, this billing dashboard can be accessed from several locations, and you reminded me one of those locations is the calendar, which is what gave me the reminder, as well as when you're on the main BillingBuilder menu, there is a billing dashboard button there as well. So you can get to the billing dashboard a number of ways. So that's what's on the demographics page. We can jump back and go into the entitlements. So the second page where there's information that's relevant for billing is in certified entitlements. And when you look at your certified entitlements screen, there's a whole series of sections there where you can collect data. The ones that are relevant for billing are the two bottom ones that are showing on the screen right now. It's the insurance/subsidized payments information. That's where you enter the client's insurance information. So when they give you that card and you know it's for Medicaid and you know the ID number, and you might not know when it started, but we'll talk about that in a minute. Yeah, I know. I put that in for my demo. Okay? Yes, that is not. No, the insurance company, when you sign up with Change Healthcare, will not be Change Healthcare. I just chose something for my demo.
An insurance company name.
Right, it'll be right. So Medicaid or Medicare or whatever the name of your managed company is. Right. Okay. So again, you'll enter when you add a new record, you'll enter the eligibility, the insurance company, the actual insurance company name, the ID number, and then the effective date. And now you might not know when the client started being insured by this company, but you know when you started providing them with treatment. So the effective date that you want to use, if you don't know anything else, is when you started providing treatment, because that date needs to be on or before the first day of service you want to bill for. Some payers, the managed care payers, and some private insurers are going to require that you get authorizations for service. And you're going to be marking it in your billing rules that you can only bill for clients who have authorizations. And then so this section here called BillingBuilder Insurance Authorizations is where you're going to enter that information. This one is easier to fill out because once you ask for that authorization, you hear back from the insurance company, they're going to give you all this information. They're going to tell you the procedures that are authorized. They're going to give you the authorization number, the effective and expiration date, and how many units or procedures are going to be authorized. So that's information they are going to be giving to you.
Make sure it's greater than the total you expect to provide.
Well, yes, but that's when you're applying. Peter said that when you ask for an authorization, you should make sure to overstate or overestimate what you think you might need. Okay, we can jump back one more time to the dashboard, and we're going to take a look at diagnosis data. Awards will not generate invoices for a client who does not have an ICD-10 diagnosis entered in their record. So if you come look here, you can see if they have a diagnosis. You might have to make sure that there are certain range of diagnosis codes that are in there if you're providing a client services in a substance abuse program. And I think this is, you probably need to make sure they have a substance abuse diagnosis, because I don't think that you'll get paid if you bill for some other diagnosis there. So you want to, see, this is where you can check to see what the diagnosis is. If you need to add a new one here, you can do that. If you need to edit the existing ones, you'll need to go through the face sheet or the medical module. Oh, and the other thing I wanted to say is you can mark them primary or secondary. Awards will take the primary one, and if you have more than one that's marked as primary, it will take the one with the oldest effective date, the oldest diagnosis date, which is considered the effective date. And so like similar to entitlements, you might not know when the client was diagnosed, but you know when you started providing them with treatment, so you want to make that on or before the first day of treatment that you want to bill for. Okay. That's it for the billing dashboard. If we can go home, because I'm just going to talk really quickly about where you're documenting services that are billable. And I'm not going into any great detail. We're really just pointing. There are 5 locations where you can enter data in awards that can then be used to create invoices. And that is progress notes in the service individual module, and group notes in the services group module, and attendance data under the reception desk. The other 2 areas are on different sections of awards, so let's go to census first. If you have a residential program, you might be billing based off nightly absences in the housing module. And if you're an agency that transports clients on a regular basis from a fixed starting point to a fixed ending point, and you're allowed to bill for that transportation, then under administration and operations, there is a transportation module where you can set up those rides and then indicate which days they actually took those rides, and then bill per mileage for those rides. So those are the areas of the documentation. Any questions? The path? Okay, so from home to transportation. From home, it's administration, and then operations, and transportation. And if you don't see 3 buttons under transportation, there might be a permission that you need. I forget the name of it offhand.
Supervisor.
Ride supervisor. We'll give you access to all 3. Okay. I think the supervisor gives you access to the ride requests section where you're setting up the rides. Okay. Great. The next thing we're going to do is talk a little bit about what's on the billing side. So this isn't client specific. This is program specific, program model specific. We can actually just go right to, in awards, we can go take a look at the BillingBuilder module. To get to the BillingBuilder module, as Josh is doing, administration, and then fiscal program, and BillingBuilder. Okay. And because we're talking about where the billing rules lie, which is what you need to in order to be able to do your billing, we're looking at the billing setup only section on the left side of your screen. So, and again, I'm just going to do an overview. Payers is where you enter your payer information. Every payer to whom you want to submit claims needs certain information entered in awards. When you look at the payers page, there's a lot of information you need to fill in. Some of it you need to obtain from the payer. Sometimes they're not so good about being able to give you the information that you need. When you have Change Healthcare involved, they can help you also fill out some of that information and collect that information. Once you have your payer set up, and you have one for every insurance company, so you might have just a few, you might have 7, or you might have 35, so it can run the gamut. Once you have your payers, you're going to configure billing types and procedures. A billing type is basically equivalent to the program model that you're administering, or maybe a group of programs that are all providing the same range of services. Those are all going to be under one billing type, and then under each billing type are the procedures, the billing rules that are applicable to that billing type. Once you have payers and billing types and procedures, you want to link those to the programs and awards where the software can find the notes or the documentation to use to bill. So you set up a program billing group, and then you use program billing info to add the programs to that program billing group. And the program billing group page over time has become one of my favorite pages because it gives you a really good overview of what your billing is. And let's take a look at one, Josh. So go into program billing groups and select my Change Healthcare fake payer that doesn't really exist in real life, and click on either view or update. It doesn't matter. Oh, it doesn't fit on the whole screen. Maybe view, okay, it does show when we do the view. And so when I look at this page, I know there's some static, and I'm sorry about that. But basically, down here, it tells you the programs in the group. And so I know that when I generate bills for this program billing group, Awards is going to look at this program or these programs if there's more than one, to find documentation that meets the requirements set up by that billing type up in the upper right-hand corner. And it's going to create those invoices to submit to the payer listed in the middle. So when somebody writes into me or writes into help desk asking questions about billing and I don't remember exactly what their configuration is, I come here first because it gives me an overview of what's going on. And if you've got a lot of billing groups and awards, sometimes if you need a reminder, it's a good place to go. Okay, so again, in addition to billing, actually before I move on, any questions? No? Okay. In addition to the information in the Billing Builder, there are two other places where you might need to enter information that will be used in your claim files. And the first one is dependent on a setting that's entered on the payer's page. On that payer's page, there's a field called Report Service Facility Information in the 837. And there it is. When you check that checkbox, Awards is going to look for an address for the program and where the documentation was entered. So in this case, we're talking, whatever the program is. So if you're providing services in more than one program and billing it all to the same, in the same billing group, you're gonna need the addresses for both of those programs. Sometimes the payers want this information. So if that box is checked off, then you need to record an address in agency program information. So let's go take a look at that. The path is slightly long. You do administration, and then system setup, and then agency program information, add, edit, entire program, select any program, it doesn't matter. And then on the address contact information, there's a street address, city, state, and zip code. That is where, when you need to include that service facility information, it is going to pull the address. So if you need to include that, you need to make sure that the program has address information here. Oh. With the extra, that's right. The zip code, client zip codes don't need the +4, but many other zip codes that you might be sending to your payers do need that +4. Okay, and then the last thing that I'm going to show you is the credentials page in Human Resources. So the Human Resources module is under Administration and then Human Resources. And then you can access it through staff information, but you can also access it through credentialing. There's a tab under Human Resources that matches what we see on the credentialing page. You can pick anybody. Pick me. Pick me. Okay. So there's a few fields on here. So this is what would be my my credential page. If I was licensed and I had an NPI number and we wanted to make sure that my NPI number got sent along with the services that I provided, then we want to enter an NPI number in that field up there. And if you could just, can we type something in there? Mm-hmm. When you put information in the NPI number, some additional fields display, because sometimes in addition to the national provider identifier, you also need to send information about my rendering attending provider's secondary ID. So when you have the NPI, you can't have a secondary ID without the NPI number. So if I have an NPI number, you're offered the opportunity to add that into, so that that can be sent along with your billing. The last thing I want to talk about is this authorizations credentials at the bottom of the page. When you're setting up your procedures, sometimes you are going to bill based on the credential of the person who provided the service. So, oh, he made me a doctor. Thank you. I didn't even know that was so easy. If there's a procedure that can only be billed if a doctor provided it, then we need to make sure that the person who provides that service is a doctor, and we do that by checking off the credentials on the very left-hand side of the page. Each credential comes along with a credential ID and an expiration date. Those are not required for billing. If you have them, you can put them in, but all you really need is that checkbox, and that needs to match what's on the procedure configuration page in order to make sure that it gets billed properly. The credential ID, it would be a license. The question was, is the credential ID a license number? And it is, but that's not where information is getting pulled from for awards. It's pulling the MPI number and possibly that secondary ID. If you don't select credential requirements in your procedures, then anybody with any credential or no credential, you can bill for the services that they've provided. So that's all that I have. I'm going to pass it on to Josh. Any questions? Yeah.
About the payer, since obviously not all the fields are filled in, is there a core group, because all payers are going to have a different guide in terms of what they require on the 837, so is there sort of like a core group that you recommend that we always fill in?
Their name, their address, right?
For the payer, I meant.
Yeah, the payer name, obviously the payer address, a receiver ID, a receiver,
Receiver ID.
just
Those are
a
your top
receiver
three.
ID. The interesting thing is if you're not sure if you need any of the other information, if you just fill those three things in, then if they want more, the first time you submit a batch to them, they'll tell you. Or Change Healthcare might be able to help you with that as well. So it's almost better to put less in than more in the beginning, because it's much easier to figure out what's missing than it is to figure out what's extraneous and causing a problem.
But it's not the payer ID, I mean, you need the payer ID as well as the receiver ID, right?
Correct. So the question was, do you need the payer ID? In short, yes. A lot of stuff in that top section of the payer screen are simply overrides. So the way that we generate 837 files is we try to make it as simple as possible, assuming that certain data is going to be the same, because a lot of data repeats itself in a claim file. So when we say at bare minimum we want to capture their name, their address, and the receiver ID in many cases is the payer ID, is the receiver code. So those other pieces are there to basically say this is an exception where their receiver ID is 1, 2, 3, 4, 5, but their payer ID is 6, 7, 8, 9, 0. But that's kind of, that's where Karen's saying that it's best to put less information there in your initial billing, so that as you get that response back, we can then slowly start to override or add information into the file. You're welcome. All right. How's everyone doing? All right. So before I get into actually talking about my slides and some of the screens in the BillingBuilder, I just wanted to kind of quickly talk about clearinghouses, because it's one of these things that we think everyone knows exactly what they do, what their purpose is, why they're there, but in some cases they're relatively new for you folks, the providers and the services that you provide, because a healthcare clearinghouse wasn't always needed. A few years back, not too long ago, it wasn't this managed care situation. It wasn't, there weren't commercial plans that were paying for these types of services. You were billing one payer. You were billing Medicaid. Why would you need a clearinghouse for one payer? In most cases, you don't. Sometimes it's helpful. But as we know, with the big changes with managed care, with commercial plans starting to cover these services, as Karen mentioned, we're moving from the single payer system to 7 to 5 to 35 to 105, whatever it might be. So the clearinghouse acts as that intermediary between you, the providers, and then obviously all those different payers that you're having to work with. They make it a bit more simple. There's lots of cases where, especially with awards, we have folks that use the system who are relatively small. They have a one-person billing team. There are some agencies that are relatively large. They have 10 to 15 people, whatever it might be. The 10 to 15 people, not a huge impact. The one, it's a huge impact. Why? Because now you're having to create EDI agreements with each one of these insurance plans, these payers. You're having to, as Karen said, go do these different portals, these different URLs to upload each one of these payers. Go back to those portals to retrieve the remittance advice. The clicks are endless. So the clearinghouse, as you can imagine, it trims that down and makes that a lot easier. As Karen also mentioned, when we were on this journey, deciding that we were going to build this interface, we were thinking, well, who do we go with? Who do we work with? There's so many clearinghouses. And we started to look at who was out there. And as we started to funnel that list down, and we started to focus on the biggest, the ones that service the most payers and so far, Change Health stuck out because they service or are able to interact with over 3,700 payers nationwide. So the chances are that if you have a payer that is a true payer, insurance, Medicaid plan, that they're going to work with them. Obviously, if you're billing small county-funded systems, those would not work, but over 3,700 payers nationwide, that made it pretty simple. So that's why we chose to go with Change Healthcare. Now we're going to get into the fun stuff. So there's basically two pieces, or the first piece that we're going to talk about right now is about your claims transmission. So to focus on claims transmission, we have benefits because we can now transmit this file directly from awards to Change Healthcare. We don't have to download the file from awards to our computer, save it, and so forth. So we're going to talk about the benefits of this, which are obviously it's much faster, it's much more secure, and because there's less clicks, obviously faster. We're going to talk a little bit about how to use it. It's pretty straightforward. I think my children could probably do it. And then obviously we're going to talk a little about how to gain access to it. So Karen, if we could just jump into the BillingBuilder, we're going to go to the Create Insurance Claims screen. So the other piece was when we developed this, we wanted to make sure that we made it as easy as possible, that we weren't making your work longer, harder. We wanted awards to do as much of the work as possible. So we wanted to have as minimal change to the screens. So when you are looking to transmit claims, we're going to go where you naturally would go. We don't want to disturb your click path, so we're going to go to Create Insurance Claims. Pardon?
You have to generate the invoice.
Well, correct. So I'm going to focus on the pieces that would be slightly different. Your billing processing doesn't change in terms of how you have to generate invoices. Awards is still going to do all that work for you. We're going to focus on how we move this data because that's the important piece here.
But you're still sending them one payer at a time.
Correct, yes. Yes, the question was, are you still transmitting one batch at a time? And the answer is yes. So as you are moving through your normal billing process, you're generating batches, you're posting your batches. Create Insurance Claims is where we put that file together still for you, and then we move that from awards to Change Healthcare. So Karen, you can pick any one of those batches in that list. I can guarantee we will reject at Change Healthcare, so that's more than fine. Now, the button that Karen just clicked, it's okay. It's all good. It becomes a multi-purpose button. We didn't want to strip functionality from you. We wanted to let you still create claims for whatever reason. Maybe you save them locally. Maybe you digest the information externally. So we didn't want to take something away from you. So the button became a multi-purpose button where you can then, as you click that, you can continue to create the 837 claim file. Probably don't want to do that. We don't want you to do that. But that's where that transmit file button comes into play. That transmit button will allow you to move that file from awards to Change Healthcare very quickly. So as Karen clicks that transmission or transmit button, you'll see that PHI, in this case it's a transmission alert, but the same language as a download alert. As you click OK, that's when that file gets moved over. And the moment that it gets moved over, it tells you there was a transmission success.
That's
Yes, go ahead.
currently available?
It's available as an add-on. Because there's an agreement, and the question was, is it currently available? It's available as an add-on because it's an agreement that you are making with us to work with Change Healthcare, and there's obviously a per claim fee for each one of those claims that you move over. And we're going to get into that a little bit more. So as that file's transmitted, we know it's been transmitted. So that file is now in the hands of Change Healthcare. So as you can see, the process, it's not radically different, but it makes it quicker and easier because we're limiting the number of clicks that you have to do, and that file is always in a secure environment. It has maintained itself in awards, and then it moved through a secure channel directly to Change Healthcare. It wasn't on someone's computer. It wasn't on their desktop. It wasn't exposed to anybody. It was from one location to the next.
Sorry, but was there any acknowledgement? Oh, I saw you press the button, but I didn't see there was an acknowledgement that.
Well, there's the message right there. Once the file is successfully transmitted, you get a transmission success. But we're going to talk about a little bit more about acknowledgement and what type of information you do get back in a moment.
Okay.
Yeah.
If it's not successful, would you get that?
You would get an error message. The only time it would not be successful would be obviously if there was some sort of an internet issue or we didn't do our due diligence and set up some of the stuff behind the scenes, which could certainly happen. But you should see this 99.9, if not 100% of the time. So at this point, now once again, the file is out of awards. All that data lives on the Change Healthcare side, which means we want to talk a little bit about what type of data we're going to get back. So we don't need to go to this slide. We can just go right to remittances and responses. So once again, it was about not changing your workflow. We want you to continue to visit the same screens. We want them to be familiar, but we had to add some functionality into the system to be able to pull that data back in so that you can read it, you can process it, you can move on with adjudicating your invoices. So with that being said, in remittance and response files, you, in your database, would see 3 new buttons. The top 2 you would see in any database. We're still going to provide you the ability to manually upload files for whatever reason. We don't want to take it away. We're still going to allow you to read files because that's the point in which you start your adjudication process where you can then post that 835 data to the claim files. But the 3 buttons at the bottom, those once again are the new pieces. So the way that we bring data back in this case we're going to talk about 835 remittance data, is through remittances, retrieve remittance response files. Yes, Peter?
So skipping over a couple of steps, like the 277 file,
Yes.
That's in here.
that's before you get an 835.
Correct. So Peter asked about the 277 file. It's basically the claim status information. We're going to talk about that in about a minute and a half.
You seem to jump to the 835, that's all.
We like the money, Peter. All right, the money. 277 doesn't give you any money. So the retrieve, yes.
277 is that crosswalk? Is that what you're saying?
The 277 is a file you receive before you get your 835, which is your true adjudication. It's going to kind of tell you that your file has been accepted, the claims are moving into adjudication, and this is what they're looking like.
And it's going to tell you which ones aren't.
Yes.
That's what you need. That's the part you need to know.
Yes.
Does it do it for Medicaid also? Or just
Any
insurance?
payer that Change Healthcare can enroll with, you can use this. And we have clients in New Jersey using it for New Jersey Medicaid. We do have a lot of New York State clients billing managed care, and as well as some commercial payers, and I believe Medicaid as well. And then obviously some other states, same thing. But they have, I'm sorry?
No, sorry, I was going to say, what about the 999 file?
So there is an acknowledge. So those are gonna, they're right around the corner. Right around the corner. Yes, a question in the back.
We have a virtual question. The way the note generates a bill is by the e-signature, so staff needs to be sure before they sign the note that all is accurate. Is that correct?
It depends on how you configure your procedures. So if you require electronic signatures, then yes. If you do not, then no. But we suggest yes. All right, so retrieve remittance response files. Go ahead and click on that, Karen. Let's see what happens. Nothing, because we don't get those back, unfortunately. Change Healthcare does not want to give us money. However, in your environment, anytime that you wanted to see if there was an 835 file ready for you on Revenue Performance Advisor, that's that Change Healthcare portal, it would automatically pull in any files that were not previously uploaded. So you could come here anytime that you wanted to see if there was something new for you to bring into the system.
So that's one click to retrieve from all payers.
Exactly. It would bring in any payers. So whether it was Medicaid, Health First plan, WellCare, Metro Plus, you name it. All those files live in one directory on Change Healthcare for you folks. Those would come back into the system. Now, as those come back into the system, this is where your billing processing takes the same course. You're still going to go to the same place to read and create remittance response files. So all the files, the 835 files that you bring into the system, are deposited in read remittance response files. So from that point on, it's the same function. The only thing that's different is we're bringing that data in, obviously, once again, in a much more secure manner, as well as in a much faster manner. So you don't have to go to the different pieces, the different places, save it to your computer, bring it into awards, and so forth. It's going to automatically bring them in there. Now we're going to talk about those other acknowledgement files. So as you transmit files to Change Healthcare, they will provide you with acknowledgement files, 999s. They'll provide you with a human-readable 277 file. Those files can be retrieved on the next button below. So retrieve clearinghouse reports, we call them. Obviously, they're not adjudication files. They're not going to get deposited into the remittance response informations. They're going to simply live in this special bucket called clearinghouse reports. But as you are provided those files and you retrieve them, they'll come back into the system. As we saw, we brought in a few new ones. And when we go back to remittances and response information, all your clearinghouse reports that you bring in will be part of this area here. Now, the reports that we're getting are not very helpful, once again, because we're not submitting real information. So our claims are never even making it past the front door. They are literally getting stopped and kicked out.
Question. So with clinicians document progress notes, right?
Mhm.
Some programs you do electronic signature, which prompts billing to bill for that service. Clinician needs the signature removed because whether it's the time frame that wasn't adequate or a piece of information that was missing, they need to add. So now you unlock it, billing has processed for that week. The person's making the changes after billing has processed, re-signs the note. Are you now telling the ward to bill for this procedure again?
Okay, so the question was, and I'm gonna do my best. I know what I want to say, but I'm gonna do my best. The question was, if you bill a note and you have to make changes to it, so you remove the e-signature, you make the changes, you sign it, can awards bill the procedure again?
Or will it automatically?
Automatically? Awards will not generate another invoice by default for the same consumer, date of service, and procedure code because it sees it as a duplicate. So without getting too deep into this, because we could go all afternoon. And I know there's another session. There's refreshments, adult refreshments, and you probably want those more than to listen to me. I want them more than to listen to me. But there's a lot of exceptions that could come into play in terms of what that next step is. You could go this route, that route, that route. But in short, no, it will not automatically generate another invoice for that same collection. You're welcome. Yes?
The clearinghouse reports, we differentiate the 999
Yes. So, Karen, if you go ahead and click into that, like I said, our data is not great because we're not getting back real information. But you'll notice that there are some acknowledgement files. So if you were to click on one of those, you could pick the first one. It won't have any real great data. And actually, I'm sorry, if you just click on the view button.
Oh, right.
So,
No, it was the view button.
yep, try.
I'm finding it's a little slow here.
So I'll talk about it. So on the screen, the acknowledgement files or the human readable claim status reports that you pull in, if you want to view them, all you have to do is click on that little magnifying glass. It would be a pop-up on the screen. You could view that information. You could certainly download it from awards to your computer. Once again, for any purpose that you have, you could do that. But the option of the radio button is to actually remove it from the system. There's not a real reason to remove the data from the system. We're here to collect data. We're here to keep data secure in one place for you. So if you've uploaded it, there's not a big, there's really no reason why you'd want to pull it out of the system. However, it doesn't seem to be that the internet or whatever is agreeing with us. However, this is where you would view those.
Just try one more.
Okay. Might be an issue with pop-ups.
I'm finding when I click on buttons that there's a lag, and so perhaps that's interfering with my ability to show you this today. It looks like we have a question in the back.
Yes.
Another virtual question. How do we know the credentials are correlating to the rates for billing? If staff have a master's degree, the rate is higher.
Yes, so that's a great question. When you configure your procedures, you can select certain credentials as required. So you can say that this procedure only bills if someone is a master's or if someone has a bachelor's or whatever it might be. Those individual procedures can be linked to individual rates. So depending on how complex your billing requirements or your fee schedule is, you can create your procedures in such a way that it will do that. So Karen, let's go back into the PowerPoint, please, and we're going to talk a little bit. We're going to fast track to a couple ahead here.
I don't know how to turn it
In
back
the upper right hand, there's a little present button.
Yeah, thank you.
You're welcome.
I don't know my left from my right stuff.
That's okay. I'm learning too.
Yeah.
So we're going to fast track. We talked about claims transmission. We talked about the retrieval of remittance information. So we're going to go past, is it not forwarding?
Oh.
Perfect. Actually, so RPA. With the time that we have, which we're running low, we're going to talk about RPA. I would love to show it to you, but I want to make sure that we get to everything else, and then obviously we can have some time for some leftover questions. But RPA, as I mentioned, it's a portal provided by Change Healthcare. When you use this connection, you receive access to this portal. This portal provides you with a lot of information about the claims that you're transmitting to Change Healthcare, what their status is, what you've billed, what's been denied by the clearinghouse, what's been denied by your payers. So once again, you're getting into now payment information. So you're collecting what was billed, what was paid, what was denied. You're also able to, within this Revenue Performance Advisor portal, be able to take all of that data and put it into some of those real pretty graphs that we, or similar graphs that we were seeing in an earlier session this morning about a new business intelligence tool that we're working to move forward with. The graphs are very similar. They're pie graphs, they're line graphs, but it takes all that data and it puts it into something more visual for you as opposed to just numbers. So their reporting is excellent in terms of looking at that data in different ways. The other nice thing about this portal is that with this portal, you are also able to learn about kind of what's going on in the industry as it relates to the payers that you are potentially working with. So they're constantly updating it with information nationally. So it might not all be about the state that you're in, but it might be about other states that very soon could affect you. So they're constantly kind of pushing that data into your login screen, which then leads me to the last piece is your login screen. you can kind of, in a way, customize your login screen so that when you log in, you're seeing data, certain information, reports that you want to see. So it just gives you another way to track all of your billing information aside from awards. Because once again, this data that lives in RPA, which is your Change Healthcare account, it lives there before it makes its way into awards. It only makes its way into awards when you tell it to. So you're going to know very quickly from their portal what was denied by the payer, what you're anticipating to get paid based on your electronic remittance advice, your 835s. So it kind of gives you that information a bit quicker in a different portal. So let's fast track one more, and let's talk a little bit about how you get access to this. So obviously, we touched on it a moment here with Kevin. This is not a standard feature. It's not a standard feature because you have to enter an agreement with us because we then become the submitter of these claims in your place to Change Healthcare. You're using our connection. So to gain access to this connection, you're going to need to fill out an agreement, which is found on Awards Online Help. In the PowerPoint here, I've provided the link to that, but obviously you all don't have this PowerPoint right now. So to access that link in Awards Online Help, you're going to click on that Awards Online Help button in the upper right-hand corner. And as you're brought into Online Help, on the left-hand side, you're going to follow your way into BillingBuilder, just like you did when you were in Awards. You'll click on Fiscal Program. You'll click on BillingBuilder. Once you're in BillingBuilder, there's that secondary window which kind of shows you all that information more to the right. As you scroll down, that's where that agreement is. So it's pretty easy to find. However, I think that we are going to make these PowerPoints live at some point on our website, so you can certainly download it and click through here as well. That agreement also talks about the pricing. So obviously, yes, yeah, I know, it does cost some money. However, our pricing, as we feel, is very is very good. Our intention was to just kind of basically take their cost that they were charging you, and then obviously move it over. So there's different groups of pricing based on the claims or the amount of claims that you're transmitting.
Per year?
It's a monthly fee. So the monthly fee, there's different ranges. I forget exactly what they are, but there's different ranges, and then there's like 2,400 plus or 2,500 plus, and then there's obviously the associated cost. Now, as you sign up for that, though, there's a couple of steps that we have to take, which means that once you sign up for that, we're going to ask you for some information. We're going to say, who at your agency do you want communicating with Change Healthcare? Because we need to now work with them. So we're going to ask you some information about your agency and your contacts. We're going to then take that information, we're going to push it out to Change Healthcare. Change Healthcare is then going to reach out to you folks within 3 to 5 business days. As they reach out to you within 3 to 5 business days, they're going to start the payer enrollment process. They're going to ask you, who do you want to bill? Which payers are you working with? And they're going to create those agreements with each one of those payers for you. That's a huge time saver. You don't need to call each payer and ask and talk and sit on their on their hold music. Maybe it's, I don't know, Kenny G. I like Kenny G. Nothing wrong with Kenny G. But you don't have to sit on their hold and wait to talk to someone and then fill out all this paperwork. They're going to take care of that for you. They're going to make that a lot easier, and that's a benefit because I don't want to talk to anyone in EDI unless there's a problem with a claim. Once that happens, they're going to create now a login for you through RPA. So they're going to give you access to that portal that I was talking about, which you can see in Awards Online Help as well. There is a recorded demo that we did where a representative from Change Healthcare actually demoed that interface. So if you want to see what it looks like where we didn't have time today, I do encourage you to go there. If you need a link to that, an easier way to find it, just let me know. I'll send it out to you. From that point on, once you're enrolled with your payers, you're going to test. You're going to send them claims. They're going to see what they look like when they come into them. So they're going to analyze all of those segments in that file and make sure that they're complete. They're not going to get deep into the data within those segments. They don't know what someone's insurance ID, well, they do know what someone's insurance ID actually is, but they're not going to look at that in testing. They're not going to look at names. They're just going to say, okay, you have a billing provider segment. There's 9 spaces. there's data in these 4 spaces, there better be data there, and it better match the format of that data. If they see an issue, they're going to work with you. It's going to involve us, and we're going to help you correct that in your setup. And then you're going to continue testing. Once you're ready to go, once you've successfully done your testing, that's when you go live, and they change your account from a testing environment to a production environment, which means that now when you submit claims, they're going to go through Change Healthcare. They're going to move them on to the payer. So obviously that's the end game. We want you to get to the live production claim submission, which we actually have a lot of clients there today who are also retrieving 835 information. So just a testament that it can be done. It works very, very well. So we're very proud to talk about this today. So at that point, we don't have a whole lot of time. We have 1 minute. So questions?
How did you go about selecting Change Healthcare?
So we looked at a lot of different factors. We wanted one that was big enough, that served enough payers. We didn't want to limit us or our clients to a smaller payer list. We also wanted to find one that offered the most services. So the services that we initially took advantage of with Change Healthcare was the 837 claims transmission and the 835 remittance retrieval back into the system. However, they offer a lot more services, which we kind of touched on towards the beginning, that we'll be including in awards in the near future. One of those was real-time eligibility. So they do have the ability to check someone's eligibility at that moment, not a 270, 271. You don't have to submit a batch file, wait a day, and get it back. It's real time. We're going to take that, and we're going to bring that data directly into the awards interface. Not sure where yet, but we're probably going to have a few key areas where it would be helpful, like the calendar, so that you folks don't have to leave awards. You can certainly choose to do that when it's part of the offering. You can go log into RPA, but we want to bring that into awards, once again limiting your clicks. So that's where, just a few reasons why we chose them, just the services that they offered and the amount of payers that they worked with. Any other questions today?
We just started using the portal that residents. There's you don't get any sort of like when a file does get downloaded into awards, there's no way of knowing it other than going into awards itself. Right?
Correct. When we retrieve files, they don't have a mechanism on their end. If you log in to say that you pulled that file in, the only way that you would know that you pulled it in would be to look at what you've uploaded into awards. Obviously, we're not going to allow you to upload the same file. Well, we're not going to allow you to retrieve the same file twice. So once you retrieve the file once, if you click that button again, it will not bring it back into the system. We don't want you to have duplicate 835 files from Change Healthcare, but you are correct. You could certainly, I know, and I'll talk to the best of my knowledge with this, not being an expert of RPA, but I am 99% sure that you can actually remove files from that location in RPA, knowing that you've already brought them into the system. But that would be obviously more of a question for them. I believe so. I know that they have a limit to where they archive them. I believe it's like 60 days or something. But I'm 99% sure that you can, I'm going to say delete, but that might not be the right term. You can actually delete them from RPA, knowing that you've brought them in so you don't have to work with them. Any other questions?
When are you going to get to multi-payer batches?
In the future. It's always in the pipeline. No, it's once again, it's a great question. When do you get to multi-payer batches? I know we got to wrap this up. It's a great question. This kind of paves that way to do that, right? Now we can transmit a batch. So the next step, can we transmit multiple batches? There's not, we can certainly do it. Obviously, it's development. So it's something that we can look into, we can move forward towards. Not there today. I don't know when it will be there, but it's a great suggestion, yes.
Stepping back to where we are today, how within Foothold do we know which payers we need to run batches for?
Oh, to run batches for, that you have to keep track of.
To generate claims?
Yeah, so that's a kind of a different question.
That's
Yeah.
Before that all happens.
Yeah, so that's a different question we could certainly talk about later. But we're going to wrap this up because people have to get to the next place And I don't want to hold you up. Thank you so much. We appreciate your time, everybody. Enjoy the rest of your day.
And don't forget the report card.
Oh, yes, the report card.